palpate is the ASIS, so it's just the front of the hips. So it's just that bony prominence right there. And then we're going to do PSIS, which is on the other side, so you turn around. And that's, well, first we can do the iliac crest. So if you just kind of bring your hands to the hips, and that's just kind of that cliff kind of right there. And then you come in and a little lower from the iliac crest, and sometimes people have dimples, you don't though, but it's just kind of that bony prominence on the back right there. So that's for palpation. If you want to sit down, we'll start with range of motion, flexion. We're just going to do everything on your right side to make it easier. So I'm going to just stabilize at the hip, and then I'll just have you actively bring your knee to your chest. Good. Let's do it 3 times. Normal range of motion for this is 0 to 120. And then while we're sitting here, we can go ahead and do manual muscle tests. So I would have you bring it up to halfway of your max, and I would have you resist. And I just push down with min, mod, max. And then we can do internal and external rotation now. It's kind of weird. Internal rotation of your hip, your foot actually goes out, and external, your foot goes in. So you're looking at the femur. So I'm going to have you do range of motion first. So this is for external rotation. So I'm going to do that 3 times also, and you'd still stabilize at the hip. Normal range of motion for external rotation is 0 to 45. And then I can have you do MMT here, so I'd hold here, and I would push outwards and have you resist it. So I do min, mod, max again. Okay, and we can do the same thing for internal rotation. So I'm going to just have you go the opposite way 3 times. Normal for this is 0 to 30. And then I can do manual muscle test again, but pushing inwards. Okay? And then we're going to go ahead and lay down on your back. And one palpation that we can do here is find your greater trochanter. And so to find this, it's on the side of your leg, and then you can kind of internally and externally rotate your leg to find that it should move and kind of spin underneath your fingers. And then range of motion for this one, I'm going to do your left leg for this one. Since we have room, it's just abduction. So it's just bringing your leg out and back in. And then normal for that is 0 to 45 degrees. And then there's 2 special tests I'm going to do in supine. The first one is testing for hip impingement. So what I'm going to do is I'm going to flex your hip, adduct your hip, and internally rotate. And if someone has hip impingement, they should feel pain right there. And then one more special test is Faber. And this one is testing for hip OA. And so you put their leg on their other knee, and then you just come here and kind of push down and you stabilize this side. And that's, if it's hurting in the front, that'll be hip OA. If they have it kind of in their buttock area, then you're looking at SI joint pathology for that. Then I'm going to have you do side lying. You can pick whichever side you want, whatever's most comfortable for you. And this is going to be MMT for abduction. So I'm going to stabilize here, and I would have you bring this up about halfway, and I would push down right here and do min, mod, max, and you'd hold that. Okay, and then I'm going to have you flip over to your stomach. And we're going to do extension, range of motion, and MMT. So I would stabilize at the hip again and have you bring your leg up and back down. And normal for this is 0 to 20 degrees. And for MMT, I'm going to have you hold here, and I'm just going to push down here again. And that's it.